Amifampridine, also known as Ruzurgi, is a medication used to treat Lambert-Eaton syndrome, a disorder that impacts nerves and muscles. This condition occurs when the immune system attacks healthy nerve cells, leading to muscle weakness. While the exact mechanism of action is not fully understood, Ruzurgi is known to alleviate symptoms of muscle weakness and loss of movement caused by Lambert-Eaton syndrome. The recommended daily dosage and optimal timing for taking Ruzurgi should be determined by a healthcare professional. Before starting Ruzurgi 10 mg tablet Aminopyridines, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor. The dosage is based on your medical condition, weight, and response to treatment. Your doctor may direct you to start this medication at a low dose to reduce the risk of side effects, and gradually increase your dose. Follow your doctor's instructions carefully. If you have trouble swallowing tablets, your doctor may instruct you to make a liquid suspension with this medication. Ask your doctor or pharmacist about what you need to make the suspension. Remember to measure the dose using a special measuring device/spoon, and refrigerate the suspension between doses. Prepare fresh suspensions daily and throw away any unused suspension after 24 hours. Take this medication regularly at the same times each day to get the most benefit from it. And don't forget to tell your doctor if your condition does not get better or if it gets worse. If you experience numbness or tingling around your mouth, tongue, face, fingers, toes, or other parts of your body, or if you feel nauseous, have diarrhea, constipation, headache, stomach or back pain, muscle spasms, or dizziness, be sure to talk to your doctor or pharmacist. They can help you manage these side effects. It's important to remember that your doctor prescribed this medication because they believe the benefits outweigh the risks. Most people who use this medication do not experience serious side effects, but it's important to notify your doctor if you have any vision changes or seizures. While it's rare, if you have a serious allergic reaction to this medication, seek medical help immediately. Symptoms of a serious allergic reaction include a rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a full list of potential side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And remember, if you have any concerns about the side effects of this medication, don't hesitate to reach out to your healthcare provider. Before starting Amifampridine, make sure to inform your doctor or pharmacist if you are allergic to it, amifampridine phosphate, or have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Before using this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have kidney problems, liver problems, or a history of seizures. This medication may cause dizziness, and consuming alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or anything that requires alertness until you can do so safely. Limiting alcoholic beverages is recommended, and if you are using marijuana, it's important to discuss this with your doctor. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It's also unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Ruzurgi 10 mg tablet, it's important to be aware of any potential interactions with other medications you may be taking. This includes both prescription and non-prescription drugs, as well as herbal products. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's important to note that amifampridine is very similar to amifampridine phosphate, so it's important not to use both at the same time. Always follow your doctor's advice and guidance when taking Ruzurgi 10 mg tablet to ensure it's being used safely and effectively. If someone takes too much Ruzurgi and shows severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe dizziness, fast or irregular heartbeat, and fainting. This medication is used to treat a certain type of neurological disorder, Lambert-Eaton myasthenic syndrome. It works by increasing the release of a chemical in the body, acetylcholine, that is needed to maintain muscle function. This medication is given by mouth with or without food as directed by your doctor, usually 3 times daily. If you are taking the tablet form of this medication, you may take it with or without food. If you are taking the suspension form of this medication, shake the bottle well before each dose. Measure the dose carefully using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. Dosage is based on your medical condition, response to treatment, and use of certain interacting drugs. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Do not stop taking this medication without consulting your doctor. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take an extra dose to make up for the missed one. When it comes to storing Ruzurgi 10 mg tablet Aminopyridines for neurological disorders, it's important to keep them at room temperature, away from light and moisture. Make sure to store them in a place that's out of reach of children and pets. If you're using the liquid suspension, it's best to store it in the refrigerator. Once you've mixed it, be sure to discard any unused suspension after 24 hours. When it comes to disposing of this medication, it's important to do so properly. Don't flush it down the toilet or pour it into a drain unless you've been specifically instructed to do so. Make sure to consult with your pharmacist or local waste disposal company to find out the best way to discard this product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.